How is palindromic rheumatism diagnosed differently? Imagine trying to catch a fleeting glimpse of something that appears suddenly and then disappears just as quickly. That's often how palindromic rheumatism presents. Unlike other joint conditions, it's characterized by brief, sudden episodes of joint pain and swelling that come and go. These attacks usually last only hours to a few days and then completely resolve, leaving no lasting damage between episodes. Because of this pattern, doctors relying heavily on a detailed medical history and careful observation during attacks to make a diagnosis. In contrast, rheumatoid arthritis tends to be more persistent. It causes ongoing, symmetrical joint inflammation that lasts for weeks or months, often affecting many joints at once. Patients with rheumatoid arthritis usually experience prolonged morning stiffness that lasts more than an hour and may develop joint damage over time. This difference in pattern helps doctors distinguish between the two. When diagnosing palindromic rheumatism, physicians often look for documented episodes. They may ask patients to keep a symptom diary or take photographs during attacks to confirm the transient nature of symptoms. It's essential because symptoms disappear between episodes, making it harder to catch during a routine exam. Rheumatoid arthritis symptoms are more consistently present, making them easier to observe during visits. Blood tests can add clues but aren't definitive on their own. Many patients with palindromic rheumatism test positive for rheumatoid factor or anti-citrullinated protein antibodies, which are also common in rheumatoid arthritis. However, these markers alone don't confirm the diagnosis. Inflammatory markers like erythrocyte sedimentation rate and C-reactive protein may be elevated during attacks but often return to normal between episodes. Imaging tests such as X-rays usually show no joint erosions in palindromic rheumatism, even after multiple attacks, whereas rheumatoid arthritis often causes visible joint damage over time. Because palindromic rheumatism shares features with other joint conditions, doctors must rule out gout, chondrocalcinosis, or other causes of recurrent monoarthritis. Ultrasound or other imaging techniques can help exclude these conditions by showing whether there is active inflammation or other abnormalities. There are specific criteria used to diagnose palindromic rheumatism, emphasizing the pattern of brief, recurrent attacks affecting different joints over time, with no evidence of joint erosion on imaging. These criteria set it apart from rheumatoid arthritis, which involves chronic, persistent joint inflammation and damage. In summary, diagnosing palindromic rheumatism involves recognizing its unique pattern of fleeting attacks, observing symptoms during episodes, and ruling out other causes. Blood tests can support the diagnosis but are not conclusive on their own. The key is understanding that this condition is episodic and does not cause the permanent joint damage typical of rheumatoid arthritis. Always consult a healthcare professional for an accurate diagnosis and personalized advice, as individual experiences can vary widely.